Thank you so much for the opportunity to speak with you today. Thank you for leadership from Supervisorial District 1 with the Honorable Hilda Solis, the Office of Immigrant Affairs, Ethnic Media Services, all the leaders that are on the call here from the hyperlocal segment and reporters. I think it's really important to have this space where we can reach our communities and reach our communities in the way that they access information. So I wanted to start with just saying a little bit about where we are in terms of COVID-19. This information is certainly led by our partners in the Department of Public Health, but I think it really exemplifies what we're seeing today. So a lot of these graphs will show the difference between where we were in March or mid summer in terms of where we are today. The thing that I want to highlight for those who are on the call today is that the numbers are going up alarmingly. We know that about 1 in 200 people are infectious with COVID-19. So for example, if you go to the grocery store, put gas, connect with people, there's likelihood that you came in contact with someone who has COVID-19 and could have been exposed. This is true not only of the cases, this is true of the percent positivity. So this is the people who test positive and have COVID-19 in terms of the testing that's going on in the community. So you can see we went from a low number to a much higher number now at 7.3%. These are the highest numbers that we've seen sometime even in the beginning of the pandemic. And we're also seeing this in terms of our hospital systems. We see that the hospitalization here is now at an average at about 2,400. So compared to July, when we had that one of our other surges, we're about 2,000. So now this really kind of creates a conversation in terms of how many people can we take care of in the hospitals? And generally speaking, when we see the numbers to this rate at 2,400, about 1 in 4 need intensive care. They need care that requires them to have more specialized and trained doctors and nurses and equipment, including ventilators. So what I really want to highlight as we think about these numbers is that it's really going to take all of us to make sure that we're doing everything we can to reduce the spread. It means wearing our face masks, staying home as much as possible, staying 6 feet away. The hospital and its ability to take care of all sick people, not only COVID-19 sick, those who are sick with COVID-19 is an important question that I think is on a lot of our minds, not only for LA County, but for the country. And for the Department of Health Services and ICU care, right now we have enough beds. We have enough beds to take care of those who may come in and have sickness that is pretty severe or even require that intensive care. But this all depends on how we do in terms of making sure that we can stop the spread of COVID-19. As you know, taking care of someone like myself as an emergency doctor, it's not only about the space to do so, it's about being able to have the doctors, the nurses, the staff that are trained and the equipment. So we have learned in the last several months and we have prepared. We have created plans to make sure that we can not only create space in terms of beds, but also create opportunity to get everything that we need, including the trained doctors and nurses and equipment. But all of that is, is a concrete, it's a number that could become limited if we don't do everything that we can now to reduce the spread of COVID-19. The biggest thing that I want to say is we really want to make sure that the communication about resources, about preventative services, about testing is reaching the communities, particularly the communities that are most impacted by COVID-19. We know that this is really hitting our Latinx, Black, Indigenous populations, and the majority of the groups that we discussed earlier in terms of numbers, not only in cases, but in mortality. And I wanted to share a little bit of a story in terms of how we're seeing this on the ground and why this might be happening. I know that we've talked a lot about access to medical care and resources, multi-generational housing and limitations to isolate and quarantine. We've also talked about a lot of our community members being essential workforce and not being able to work from home, for example. But I also think a lot of this is a reflection of institutional differences in racism and lack of accurate information. During the summer, there was a forum that was held by a radio talk show. And I think that really exemplified how community is resorting to even accessing information. Maggie Carrillo Vasquez is a 10-year-old girl who called onto one of these national radio shows to get information for her parents. Her parents are both essential workforce. They worked for McDonald's. They got sick. They had questions about how do they take care of themselves? How do they isolate? When can they go back to work? And Maggie was the one calling to ask the questions because her parents didn't speak English. I think that this is not an isolated situation. And in fact, this was very similar to how I grew up with my family. We're a young family. My parents immigrated from Mexico, and we straddled across how to access that information living in Southeast LA. And even now, as an emergency doctor, I see this with the patients that I care for in the ER, where a lot of the gaps have been in being able to know where to go for information and where to go for resources and services. When I tell a patient that they're positive for COVID-19, the next question isn't quarantine and isolate. The next question is, who do you live with? How many people live there? How can we make sure that we have a plan to take care of you and your family? And I feel very grateful to work in a county and a department where from the emergency department, I can refer someone to quarantine and isolation. And I'm also very grateful to know that the county has made this available as a resource to community members. So if they live in multi-generational housing or cannot quarantine and isolate for whatever reason, they can call a number, and I'll display that here so that they can get access to that quarantine and isolation. Maggie's story and the stories of my patients really highlight the measures that a lot of our community members are having to resort to access basic information. I think that it's really important to think about not only the cultural relevancy and the language of our communities, but also that it's coming from those who we trust. I want to acknowledge that there are many front lines to this pandemic, as our partners at DPSS and OIA, our hospitals and ERs that are our front line of caring for our communities, and extending beyond our hospital walls are our community partners. Community-based organizations share culture, language, life experiences of the communities who we serve and are most impacted by COVID-19. They've earned the trust of our families and our community members in their work around social justice. On Wednesday, LA County partnered with the Department of Health Services and the Department of Public Health to launch a community equity fund. This is a fund that will support about 50 community-based organizations to help spread the word and information on COVID-19 resources in the hope to prevent and decrease the spread of COVID-19 in their communities. These community-based organizations will be our partners in sharing information of a range of services like outreach, education, and in some cases, contact tracing, but also system navigation. And it will be really coming from the community. We are really excited to partner with community partners, community-based organizations, and philanthropy around this work and this opportunity to really collectively uplift those that are hardest hit and address the immediate needs of our community during this time. I acknowledge that the testing access is a very important piece, but it's not the only way that we're thinking about how to care and support our communities during this time. I do want to share an update and where we are and how we have grown over the last several months as a system in terms of testing access. So testing is available in the community. We always want to highlight that this testing is available free of charge, regardless of immigration status, will not be part of a public charge. Um, you know, this is one of the things that comes up a lot in terms of barriers, but it is accessible to anyone who requires that COVID-19 testing. Certainly, if community member has a primary care doctor, we're encouraging community to go to the primary care doctor so that we continue to hold that ability to test more in the community who don't have any other way to access care. You can call 211 to get an appointment for testing, or you can visit the COVID-19 lacounty.gov testing website. This is the number for self-referral to quarantine and isolation, and you can see that the line is available there. So community members can call if they require that, and that's a little bit more in terms of our community partnerships. How we have grown is that there's over 180 testing sites across LA County. Our goal is really to integrate these into highly impacted communities. And we're constantly thinking about how can we bridge that gap in access, including mobile testing, for example. Walk-up sites are available, so community members don't need to have a car. They'll have to register either through 211 or through the web page, but you can see that there's some walk-up sites available for community members. And then the testing site also has an array of information on resources. So I think that this really kind of delineates some of the things that we wanted to share in terms of, where we are as a system, how we're thinking about equity and testing. Again, with testing, we're always thinking about how to make this more accessible. So in the next week or so, we're going to launch this learning opportunity in terms of at-home testing. So if people visit our site and meet, the apply for an at-home test, they'll get a test delivered to them that they can take themselves at home and then return back. This is with a smaller launch during the holiday season because we're seeing so many numbers come up. This allows us to kind of bridge gap and be able to provide more service. It is currently on the online platform and in English. So I want to acknowledge that creates some access issues, but we're working really hard to make this accessible in Spanish and in other languages in the very short future. The virus is impacting all of us, not only me as an emergency department doctor and seeing what this means in the community, but our families, our communities. It'll continue to impact us in this way until we have a vaccine and kind of work through all those pieces on the vaccine. There is promising news about COVID-19 vaccines, but we're not there yet. And I really want to make sure that it's communicated to our communities that we all need to do everything that we can to keep ourselves safe and secure. And, I hope they can lean on the county and we can be there for them during this time.